Hey everyone, Michelle here, personal trainer and lifestyle coach. Tonight we are joined by Katie Crawford, who is a dietitian at a bariatric surgery clinic. And I'm super excited to hear about everything that you do and about the clients that you work with. Katie, can you tell us a little bit about what you do?
Hi, yeah. First of all, thanks for having me, Michelle. And I love your shirt, repping the Blazers.
Yeah.
Yeah, so I guess you would call me like an outpatient dietitian. So I see patients not in the hospital, um, mainly working with patients who are wanting to have bariatric surgery. So I think most people are familiar with that as gastric bypass. And then there's also gastric sleeve patients as well. And so I kind of help guide them through the process before surgery to make sure that, they're kind of making these healthy changes and habits prior to surgery. And then I follow up with them after surgery to kind of make sure that they're meeting all their nutritional needs too.
Very cool. And we talked about this briefly. So these patients, do they expect to see a nutritionist? Do they know that that's going to happen?
Yes, well, they should. Yes, yeah, they meet with a dietitian. Everyone has to meet with a dietitian prior to having the surgery, just to make sure that that us dietitians don't have any huge concerns or red flags about a patient and kind of their eating habits and that sort of thing, um, if they're wanting to have surgery.
Okay. So, for someone who might be eligible for this type of surgery, what types of characteristics are you looking for to see if they are going to be eligible?
That's a good question. There I would say there aren't a ton of like hard, like just straight up no's from the dietitians. It I would say that's more kind of the behavioral health provider, their kind of input on that, just because that's kind of their obviously their forte. But what we look at, we just want to make sure that people are, willing to work on these changes, because it can be dangerous, if a patient, has surgery and then just does not focus on eating, nutrient dense foods, or at least a little bit, or take their vitamins and minerals and that sort of thing, those supplements, that could be, I mean, yeah, that can be dangerous. So we just want to make sure people are compliant, which is a word that we're trying to move away from. But yeah, just to kind of give you an idea.
Okay. And why do you think you guys are trying to move away from the word compliant?
We're trying to move away from that word mainly because it kind of has like a negative connotation to it. It's kind of a black and white way of thinking. Like this patient is like compliant, so they're good. They're being good, or if they're non-compliant, they're being bad. And so us providers are just really trying to move away from that type of language, like shameful language almost,
Yeah.
because that's not very empowering, and that doesn't do the patient any good to hear their providers kind of have these negative, way of describing them. So it's not very conducive to
Yeah.
making healthy changes.
That's cool. So, is there other language that you're trying to use instead?
Yeah. So I guess I would say, patient has been working on changes like X, Y, and Z and being kind of more specific. Or, we kind of like other language I would say I focus on is, patients would benefit from working on XYZ, that sort of thing. So I guess a bit softer language. And then kind of the same idea around, I think a lot of people still use like disease first language, meaning like diabetics. We're trying to move away from that and say people with diabetes. So it's the patient, the person first before the condition or disease.
Okay, definitely. Do you see a lot of people with diabetes that are looking to get some type of bariatric surgery?
Totally. I think that's one of the huge draws to it because I mean, the surgery isn't, it doesn't just reduce the size of the stomach. There's a whole bunch of like metabolic changes that are happening, um, that support, better blood sugar control. And I think that's a huge draw for a lot of patients. When they come to see me, a lot of them are like, I want to get off my diabetes medications. And so, yeah, I think that's a huge motivation for a lot of people, but it's not a cure all, right? It doesn't mean that the surgery is going to kind of completely cure their diabetes. But for some, it seems to really manage their blood sugars really well. And we do have a lot of patients that completely come off their medication. So that's really cool to see.
Very cool. So I guess from a, because I'm a trainer and that sort of thing, and obviously you deal a lot with nutrition. From that standpoint, a lot of it seems to be still diet and exercise and those types of things. So how would you say that these types of surgeries can enhance the benefits of those other things?
Yeah, that's a really good question. Well said. Um, It so kind of going back to what I was just saying about how the surgery doesn't just make the stomach physically smaller. There's a ton of, again, metabolic changes that are happening. That one of the biggest things is that the surgery, so a lot of the hormones we make around appetite and hunger are made in our stomachs. And so obviously when someone's stomach is being, reduced in size, that kind of changes how somebody makes those hormones. And so that can often suppress their hunger cues and their hunger levels and their appetite. And so I have a lot of patients who just don't have much desire to eat. Like it doesn't do the same kind of thing that it did for them prior to surgery. And I would say that's one of the biggest things for a lot of my patients that I work with, is that it just changes their appetite. So obviously, when your appetite changes, that makes it a lot easier to, eat smaller portions, um, choose maybe healthier foods, and that sort of thing.
Okay. And you had mentioned that they meet with a behavioral specialist as well. Is there a
Mhm.
psychology aspect to all of this?
Oh, yes. Every patient, they have to meet with not just dietitian, but a behavioral health provider. So we have psychologists in our clinic. And so every patient has to meet with them prior to surgery. And um, the behavioral health provider just makes sure that the patient is safe to kind of proceed with surgery from like a mental health standpoint. So they just want to make sure that they're kind of stable, and um, that no one can predict how successful someone's going to have the patient work on mental health prior to surgery and then reevaluate, make
Okay.
sure again that they're safe.
Okay. So if someone had a history of some type of eating disorder or something, that's the route that they would go.
Yeah, like an active eating disorder, that I would say that would probably be a hard stop. Um, History, I mean, that's pretty common, unfortunately, with this population. Um, but if the person has worked on it and it's not currently an active eating disorder, then that's kind of up to the behavioral health provider. But I would say it's not a hard stop if it's like a history of a disorder.
Okay. Interesting. All right.
Yeah.
So then, what other factors do you think that people need to consider before they decide if this is an appropriate route for them?
Factors, oh, so many. I mean, I will say, I think a lot of people hear bariatric surgery or gastric bypass and think it's kind of like a cop out, right? Like it's the easy way out for somebody to take to lose weight. But I would argue it's the opposite. I would say it's very challenging um, for most people after surgery, because you're working with such a small stomach that you're still, your protein needs don't change, your fluid needs don't change, but your stomach is so small that, I mean, that's challenging, right? To get enough protein in, to get enough fluids in, to get in enough produce like vegetables, taking all their vitamin supplements and all of that. So, I mean, there's not a whole lot of room left in the stomach when you're filling up on, those kind of, um, I don't want to say, yeah, I guess those important things. Um, and so that doesn't leave a lot of room for anything else. So, I mean, I don't want to say it's like it's kind of like a sacrifice, right? That someone's making, that they're kind of, they're not completely giving up these like junk foods or, empty calorie foods necessarily, but I mean, it changes, it reduces quite a bit. And so that's hard. I think that's really hard, especially kind of in today's society. But anyways, I feel like I just did not answer your question. I'm totally like going on a tangent. Remind me what your question was.
Basically, like what types of factors should they consider before they decide if this is a good option for them?
Okay, yeah. I mean, that's a huge one. It's just, are they willing to kind of make these sacrifices in terms of, prioritizing certain foods over others? For the most part, there really isn't one food that I'm going to say that they can't have ever, but it's about moderation. And I would say the moderation piece is, less wiggle room again with somebody who's had this surgery. Um, so if they're willing to kind of work on that, obviously, no one expects anybody to be perfect with the way they eat, and there is no way, one way of perfect eating. Um, but I think it's just being willing to kind of work on these things for the rest of their lives, which, sounds daunting, but I think that's the biggest thing.
Cool. So it sounds like it might be harder to get the nutrients that you need. What types of recommendations do you make sure people are still at least getting those basic nutrients?
Yeah, I mean, we push protein first. So I think, a lot of people are taught eat your vegetables first, but with this population, we're saying eat your protein first because you just have to prioritize, right? You've got to start eating the most important thing. And in this case, it's protein. Um, Not to say we don't also encourage vegetables, because we most certainly do. But they're not, I would say protein is number one, and then vegetables after that. And some people just fill up on the protein and they don't really have room for vegetables. Um, so that's kind of the number one thing we look at is protein. Um, Obviously, fluids, staying hydrated, that can be a challenge for a lot of people for quite some time after. So it's about kind of staying on top of their hydration, meaning it just requires a lot of small sips of fluid throughout the day because you can't really chug a huge amount of volume at once. Um, so protein, fluids, um, trying to get some produce in if they can, at least a little bit throughout the day. And then taking all their vitamins and mineral supplements. That's really important. And then, of course, we track labs every so often after surgery just to make sure that they're not deficient or low in anything.
Okay, definitely. So is that sustainable in terms, I know that there's a quadrillion different diets that people could do, right?
Yeah.
And keto being a high fat, high protein type of thing, it doesn't sound like fat is as pressing in this conversation, but is it still sustainable in terms of your digestive system if you're not getting like those fibers and stuff in?
Yeah, that's a really good question. When I first started this job, that was my question. I'm like, how are these people, not like, yeah, with all the lack of fiber, like, how does that not affect their digestion and just feel, overall health? But the body is, what I've learned is the body is incredible and it's so resilient and it just adjusts to kind of whatever you give it. Um, so with the fiber piece, I mean, we do still try to, I know we push the protein, but we also do really try to push the fiber. But a lot of people, their bodies just adjust and they get used to it. And I mean, yeah, it kind of seems okay, and I've seen patients that are like, maybe decades out from surgery and they haven't had any issues. And really, I think the bottom line is that they've just lost the weight. And I would say for certain people, that weight loss is going to be a lot healthier than trying to get enough fiber and certain things in, if that kind of makes sense.
Hmm.
Yeah.
Okay, very cool. So then, obviously, you primarily work with people in this particular field. But just generally speaking, are there some carryover from the suggestions that you make for the bariatric patients, and then also just general population for general nutrition needs?
Yeah, totally. Um, like two big things come to mind. I'd say the first, we call it like lean green eating, meaning lean protein paired with just kind of colorful produce, and trying to pair those two things together as much as you can for meals and snacks. Um, so, for example, that would be like celery and like almond butter, right? You've got your protein and you've got your colorful celery. Um, that's something that we definitely talk a lot about with our patients who are having bariatric surgery. But general population, I do work with non-surgical patients as well, and that is something else that I also talk to them about, is that lean green kind of way of eating. Um, just because, as simple as it's very simple. We all know protein, great. We all know produce, vegetables, healthy. But I think not enough people really eat that way. Um, and so that combination alone is just going to do wonders for everybody's body, um, because the protein and the fiber kind of help control blood sugars, whether somebody has diabetes or not. I think that's huge, um, because of insulin resistance, which is, I won't get too much into it because I can go off on a tangent for hours with this topic, but insulin resistance is huge, especially in today's society, where basically our bodies don't efficiently use insulin like they're supposed to. And when we have too much insulin going on, that just kind of leads to all of these chronic diseases. So heart disease, diabetes, obviously, maybe some kidney issues, that sort of thing. So it's just kind of this cascade of events that are happening if someone does have insulin resistance, and it can get worse over time. And so that protein and fiber kind of help prevent that, or kind of help manage that quite a bit.
So to dive into it just a teeny bit, what are the most common factors, would you say, in insulin resistance?
So many reasons. Obviously, the way we eat is a huge factor in that. So basically, if we eat, our bodies do a lot better when we eat smaller portions kind of more regularly throughout the day, versus, I think it's the standard American diet where we eat kind of 3 meals a day that are maybe a bit bigger. That is kind of the worst thing we can do for insulin resistance. So it's not so much about, the amount of carbs you're eating in a day. It's way more important to focus on how many carbs you're eating at once. And so kind of eating those smaller portions is going to help not overload the body, and, theoretically not lead to insulin resistance as much. So that's something, that I see a lot. I see a lot of women specifically who don't eat most of the day. They may eat a little tiny bit, but not enough to fuel themselves until in the evening. And then of course, their bodies are starving. And so they eat a larger portion, maybe some snacks after dinner in the evening. And so it's just kind of this vicious cycle. And again, that they're just kind of overloading their bodies and overwhelming them. And so that can definitely lead to insulin resistance. And then the second part would be lack of physical activity. That's huge. Um, Again, I don't want to get, give you too many details on this, but basically what I explain to patients with physical activity is, so if you think of like insulin as like a lock and key system, so in when insulin is working normally, basically what it does is insulin kind of attaches to your, we'll say, muscle cell, and then it unlocks your cell, and then the sugar in your blood can get into it. What's happening with insulin resistance is that lock and key system, there's like a disconnect happening. And so the sugar in your blood can't get into your muscles or your cells. And so it's just floating around in your blood with nowhere to go. And that's, again, high blood sugars. And with physical activity, that it helps that lock and key system work way more efficiently. So that's a huge part of it too.
Okay, very cool. Awesome. All right. And then what are some, I guess, concerns that you get from your patients specifically when they are, changing their diets, when they're thinking about getting surgery, post-op especially? What are some major concerns that you get from them?
Stop. Yeah. Like the first thing that comes to mind is hair loss.
Oh,
I know. People are very concerned, and rightfully so. I would stress out about hair loss too. Um, and, basically what we tell patients is the hair loss is, unfortunately, it's very common and normal after surgery. There's like a window of time, where it's common that it starts around 3 months after surgery. And I think it's a combination of things. So it's not lack of XYZ nutrients like vitamins or minerals necessarily. It's more from like the stress that their bodies went under with the surgery itself. I mean, they've changed their digestive system. And so obviously that's a trauma to the body, and the body just responds with kind of hair loss being one of the things. And so most of the time in that situation, there's no like vitamin or mineral supplement that they can take to kind of help with that. Although, a lot of people swear by biotin or the hair, skin, and nail supplement. Not enough research to back that up, but placebo effect, I'm not going to fight them on that.
I didn't even know about that. I had never heard that before.
Yeah. Hair loss. Yeah. Real and stressful. Yeah.
So does it start to grow back in after a while?
It does. Yeah. Slowly. But yeah, it does grow back. And it's usually women that have more hair loss than men. And I don't know, I don't have any stats on that. I don't know if it's because I see more women than men, so I'm just kind of getting those biased numbers, or men don't have I don't know.
Okay.
Yeah.
Now you just made an interesting point. You said you see more women than men. Is there a higher percentage of women getting bariatric surgeries?
Yeah. I don't have stats for you. I should have looked this up, but yes, I would say majority of patients that I work with are women. And I would say if I had to throw out a number, maybe like 75% women.
Wow.
That's total ballpark, but it's overwhelmingly women. Yeah. Which, oh, sorry. Yeah.
I was gonna say, do you think there's a reason why?
Yeah, I was just gonna, yeah. We're on the same page. Totally. I think it's society and all the messages that women specifically get from a young age. where we're kind of way more self-conscious of how we look, our bodies look. And so yeah, I think that absolutely plays a role in why I work with way more women than men. Um, yeah.
Definitely. So, just to shift back a teeny bit back into the dietary piece, now you see some of these clients multiple times. Do you also have clients that you only see once or twice?
Yeah, good question. Honestly, it depends on insurance mostly. So if some insurances require a patient in order to have the surgery in the first place, some insurances will say, okay, you got to meet with a dietitian once a month for 3 months or 6 months. And so obviously I build like a good rapport with those patients when I'm seeing them monthly. And then other insurances don't have that requirement and they would just see a dietitian once. Um, I prefer working with patients monthly just because that gives them time to make all of these huge changes, um, instead of just meeting once and then you're kind of thrown into things with figuring things out for after surgery. And so it's just not enough time to really establish those new healthy habits. Um, but yeah, I definitely am an advocate for working with a dietitian multiple times prior to surgery.
Okay. So, when you meet with them, are you giving them like a dietary plan, or is there like a brochure of sorts that you can kind of give them, or how does that work?
Yeah, that's also a good question. It's interesting. I don't want to say we hate meal plans. We're not fans because it's not sustainable. We're human. We don't want to eat something somebody has told us to eat if we don't feel like it. We want options, and so I will only write a meal plan if someone is really adamant about it. Um, but most people, we give them kind of that template of kind of what I touched on, which is like the lean green way of eating. So, we kind of review lean proteins. Obviously, everybody knows what produce, vegetables, fruits are, and like trying to pair those together. So, a lot of times I'll, work with the patient in terms of coming up with like their own, like, I guess, individualized list of like snacks or meals that have that that lean protein and that produce together,
Okay.
so that they can kind of draw from those lists, more as a template. And then that's just to get them started. And then the wheels start turning, and then they can kind of create their own snacks and meals down the road with, that protein and that produce too.
So, kind of giving that empowerment piece
Yes,
almost.
exactly.
Yeah.
It's all about kind of finding a sustainable way of eating. Nobody eats the same way. And so I think it's important to recognize that and not give someone a specific meal plan. I mean, obviously there's a time and place for that, I think. But with this population, I would say it's all about giving people options and the freedom. And like you said, it's very empowering to be able to choose, what you want to eat and not sticking with a strict diet.
Yeah.
So
Cool. Now, do you feel like that helps with the adherence piece? Because I know that's something that everybody struggles with, right?
yeah, absolutely. 100%. I would say, the patients that are probably the most successful are the ones who find a sustainable way of eating. So they're not telling themselves they can't have a certain food. They're not saying, okay, I'm never going to have bread again, or I'm never going to have XYZ again. Moderation, right? And it's about kind of that, it takes away that, I guess, that power, or, when something's forbidden, we only last so long. And then, when we have that forbidden food, we often maybe binge on it, or, go way overboard with it. But as soon as we tell ourselves, you can have bread, you can have potatoes, you can have XYZ, that kind of takes the power away from the food. And so just giving yourself the permission to have those foods in the first place, a lot of times that's enough to kind of more practice that moderation piece.
Definitely. Okay, very cool. And just kind of getting back to your background a little bit, do you feel like working with people and doing nutrition conversations all the time, does that put any pressure on you and your diet? You know what I
I totally know what you mean. And I always say, Michelle, I'm like a loosey goosey dietitian. I am not the healthiest eater. I'm gonna be honest with you. Um, but I kind of use that like 90%, 10%. So like 90% of the time, I'm eating kind of that lean, green way of eating. I feel so much better when I do it. The other 10% of the time, it's indulging maybe a little bit, which I think is important. I think it's really important for people to understand that nutrition isn't just about physical health, right? We have to nourish all the other parts of us. So that's like nourishing your cravings sometimes, nourishing the social connection over food, traditions like holidays, that sort of thing. I think those are really important too. Um, and so again, it's just giving yourself permission to enjoy those things, but again, kind of using that 90-10 type of way.
Okay, definitely. And then kind of getting into the exercise aspect. So we met through a gym, right? And we used to kind of work out together and stuff like that. So, what are some things that you kind of suggest to other people for activity? And then tell us a little bit about what you like to do.
Yeah, so for active, luckily so we have physical therapists at our clinic, and they are the ones to kind of come up with that physical activity plan. But what I generally say, like especially if it's a non-surgical patient, um, is just because I don't want to step on the PT's toes, and their plan with the patient, the surgical patients. But it's about finding what you like, right? Um, I mean, we can only make ourselves do a certain exercise for so long before we're going to burn out. Um, and so I really try to push it with patients that you have to find a physical activity that you enjoy, because you're going to stick with that long term. Um, so that, whether that's yoga, whether that's walking, whether that's going to the gym. So it's just finding what they like. And then I also say for, the kind of a certain population of my patients, I'll say, it doesn't even have to be like 30 minutes, right? Start with 10 minutes, build up from there. And even, what the research shows in terms of like blood sugars and diabetes and that sort of thing is that, so the recommendation is 150 minutes of physical activity per week. Yeah, per week. So that kind of boils down to 30 minutes, at least 5 days a week. Did I do that right?
Yeah.
Yeah, okay. um, yeah, these recommendations better than I do. But what I'll say with patients who are just starting out is that 150 minutes, it doesn't, or that 30 minutes doesn't need to be consecutive. It can be 10 minutes here, 10 minutes here, 10 minutes here. And even that has shown benefits in terms of controlling blood sugars and weight loss and that sort of thing. So more blood sugars than weight loss, but yeah.
Very cool.
And then the second part of the question was
What do you
about
like
what
to
I
do?
like to do.
Yeah.
Oh man, I love CrossFit. I mean, that's how we met. I loved taking CrossFit classes with other people. I thought that was so motivating and I thought it was fun. I mean, prior to CrossFit, I didn't have an activity that I loved. I would force myself to go to the gym and do the standard, cardio and weights, but I hated it. And I just forced myself to go because I knew it was healthy. but I would go through phases. I would, go for maybe a couple months and then burn out and stop going. So it's just this not good cycle, until I found CrossFit. And I'm so glad I did because it's been a game changer. It's something that I love. And so, I've been going consistently for years. And now I work out in a garage solo, so I don't have other people around me like I used to. But honestly, I've found that that's more motivating to me, which I know it's the opposite. A lot of people find it more motivating to work out with others, but for myself, I have found that I come up with excuses when I work out with other people. I'm like, they're gonna beat me. Why would I try in this workout? But when I'm alone, it's just me. And so as cheesy as it sounds, I'm the only one competing against me. And so I tend to push myself a lot harder. Not every day, but generally I would say, yeah. So again, it's just about finding an activity that you actually love. But I mean, don't get me wrong. Some days I don't feel like going, but I kind of force myself to. And sometimes it works. And I'm like, yeah, okay, I'm like feeling better now that I'm here. Other times I'm just going through the motions.
Yeah.
Yeah.
So how would you say that you keep yourself accountable? Is that just from a habit or?
Yeah, I would say it's just habits. It's, I would say I have made it like a non-negotiable for myself. It's, I try really hard not to cancel working out, and make plans after. So whether that's making plans with friends or like having, running errands and that sort of thing, I've made it, and for the most 99% of the time, I would say it's a non-negotiable for me to get my workout in. And sometimes that means I have to work out super early, in the morning so that I can get to like this event or XYZ after work. But um, I would say it's just a habit, and not really, sticking with it and having like a backup plan, like working out in the morning if you won't be able to do it after work and that sort of thing.
Yeah.
But I don't really have good tips for that. I just like force myself to do it.
Which is a tip in itself, absolutely.
Yeah.
Okay, cool. So obviously you're super passionate about this, both, the fitness and the nutrition aspect. How did you get into this and why did it catch your interest?
Yeah. Um, it more honestly, I wanted to be a doctor. I knew I wanted to be in the like healthcare medical field. Freshman year, I was like, nope, don't want to be a doctor. I don't want to go to med school. And so I didn't really want to be a nurse. And so my mom was actually the one who suggested studying nutrition because she has some friends that are dietitians. And and so I was like, yeah, that actually sounds like a good fit. Like I love science. I love nutrition, like learning about foods and how they affect our bodies. It's healthcare. So I was like, I'm sold. Um, and I've always been interested too in, I don't know, it's just, I guess, how food affects the body. And at first, I think it stemmed more from body image and, like, okay, like diet culture and that sort of thing. At a young age, like middle school, high school, I think most girls kind of struggle with body image. And so I just remember kind of reading these like stupid gossip magazines about like the 10, top 10 diets of the year or whatever, but I loved those things. Um, and so it kind of stemmed from that. And then it just turned into this passion, and not so much the dieting part, but um, just kind of this love of how what we eat affects our bodies and the way we feel physically, mentally, all of that.
Very cool. So do
Yeah.
you think you'll stay in this field for a while? Is there anything else that you've wanted to explore?
Definitely nutrition. I want to stay in nutrition, yeah, indefinitely if I can. Um, Outpatient work is I love it. This started as my dream job. I like wanted to work um, kind of this specific job, really. Um, but with any job, when you kind of do the same thing every day, you feel the burnout. And working with patients, people, one on one, 8 hours a day, 5 days a week, that can be a lot. It's kind of exhausting. Um, I love my patients, don't get me wrong, but doing that 40 hours a week, it can be draining, especially when people are kind of talking to you about, I mean, their relationships with food, and that can be a lot of, emotional information there. And so it can be really draining, especially when people, I feel fortunate that people feel comfortable opening up about their relationship with food and maybe past traumas, but it can be a lot to kind of take in. And so I don't think I can do this forever. Um, but I've been there for 4 years now. And so I don't know, we'll see. But I don't want to pigeonhole myself into like outpatient work. I think I want to kind of explore other opportunities in the nutrition field. Maybe less conventional. So, like maybe more behind the scenes, like with food labels and that sort of thing. But I
Okay.
don't know. We'll see. Stay tuned.
Okay, fun. So, just a piece that you kind of talked about was, people opening up about their relationship with food and those types of things. Are these things that they taught you to deal with in school?
No, and I'm so happy you asked me that question. No one asks me that question, so I love that you even thought of it. No, they don't. It's insane. I feel like half of my job is like being a counselor, being a therapist. They don't. I took, I think, maybe one class on this. Not certainly not enough to like be a professional at it. You just kind of learn as you go. Um, but I mean, I think that's really important. I mean, they should kind of make it more of a requirement in undergrad. Is learning how to counsel people and kind of listening to these different, traumas and things like that, and how to respond. But I will say a lot of times somebody just wants you to listen. They don't need advice. They don't need you to really say much. They just want somebody to listen. And I think a lot of these patients have been burned by the health, by the medical field, by the healthcare, um, and shamed for their size, by their doctors, by, by providers that, they thought they could trust. But so I think a lot of times people just want you to listen. And so I can definitely listen. Um, but all the other kind of counseling things that definitely they don't teach us enough of that. And it's learn as you go.
So, with you having this, unique position where people are feeling comfortable, and obviously you're helping provide a bit of a network for them, can you talk a little bit more about, we've talked about social support and those types of things, but building a network and how that can help affect people?
Yeah. So network. So I mean, first of all, we always tell patients they can follow up with our team as often as they want, whether their insurance requires it or not. And I think a lot of patients find that helpful, just to have kind of that accountability with somebody. Um, but I think obviously, maybe that's once a month that they're coming in, maybe once every couple weeks, but most of the support is going to happen outside the clinic. And so I think it's really important for people to have at least one like partner or one like accountability partner. whether it's a friend or a family member, someone that they can kind of celebrate their victories with, or when they need kind of that accountability piece, that partner can kind of help keep them on track. So we do, make it really clear that support from friends and family are really important, but to also use our clinic kind of as needed for that too. And then we also have a support group of it's just patients from our clinic, um, where, I mean, we used to meet in person, now it's over Zoom, but it's, people who have had surgery, people who are thinking about surgery, and everybody in between. And it's just a forum, a place for people to kind of talk about their experiences, their fears, their struggles. And that could be really helpful for them because it's people in the same boat. I haven't had bariatric surgery, so I can't even begin to understand what some of their struggles are. And so I think that's also a really helpful forum for people for support.
Very cool. So with people, because obviously that's for your patients specifically. So with people that are interested in learning a little bit more, is there some resources that maybe that they could go to, or some people that maybe they should follow?
Totally. I'll try to keep this part short. Um, First one that comes to mind is, it's called Intuitive Eating. It's by Evelyn Tribal. I don't know, I'm totally probably butchering that, but she's a dietitian. She wrote Intuitive Eating. It's this book, and it's this concept of, basically, it's listening to your body and relying on your body to guide your eating habits. So just to kind of sum it up quickly, intuitive eating is like, young children are kind of the best intuitive eaters. They really don't overeat. Um, they don't eat emotional eat, right? They kind of eat when they're hungry. Um, uh, and kind of that sort of thing. And so the book it's a super easy read, simple concepts, but it's just kind of relearning how to kind of eat like a child again. And so that book was a game changer. I read that during undergrad. I loved it. And it just kind of establishes your relationship around food and fueling your body, just because I think society has completely messed up our relationship with food, and the diet culture and all of that. And so it's just kind of shutting that all out and relearning how to listen to your body and letting that guide your food choices. So that, I would say, is game changer, at least for me it was. And then kind of a more fun resource, I would say, is Rachel Good Eats. She's on Instagram, TikTok, kind of all over the place. She's a dietitian from OSU, actually, Oregon State. And she is so fun to follow. She's so knowledgeable. And very aesthetically pleasing. So it's fun to look at her page. She has easy, healthy recipes. She's a personal trainer too. So she's got a workout program, and just a lot of kind of helpful tips and knowledge kind of sprinkled throughout. And she has a blog, and that has a lot more kind of nitty gritty information. Love her. And then the last one I'll give you is FWD Nutrition, I believe. But basically, it's a couple dietitians who are kind of sports nutrition, but more holistic. So they try to focus more on whole natural foods, to kind of properly fuel your body for, athletes and lots of physical activity and that sort of thing. Yeah.
Awesome. And then the last question I have for you is just, with so much information out there, how do we know what to listen to?
Yeah, that's a really tough question to answer. Really important question. That's hard. I would say you want to see where it's coming from, right? Um, so whether it's a university, like a hospital, something major like that, and then who wrote it? Was it a dietitian? Because yes, I will say dietitians, you can definitely trust what they're writing and what they're saying. Um, and then it honestly depends on, even there are even some doctors out there that I would say don't have the full understanding of nutrition. Um, so that even maybe I honestly don't have a good answer as far as that part, but definitely a dietitian. And then um, I mean, what we go back to is going to be peer-reviewed journal articles, which not very dry, not fun. Um, but that should be kind of the heart of any nutrition information out there. Um, and so, yeah, that should kind of be the root of all of these kind of, I guess, nutrition resources. Um, I don't have a super good answer for you there. That's a hard one. Sometimes it's hard for me to tell, to be honest with you, how to kind of weed out, you know, not the legit resources.
Mhm. Okay. So it does sound like people that at least specialize in registered dietitians and such.
Yeah.
What about nutritionists? Because that's a title too, right? Is that different than a registered dietitian?
Yes, I'm so glad you said that because that was going to be my next point. Um, totally different. So registered dietitians have to have, a bachelor's in nutrition or some sort of nutrition science. And then they have to do a dietetic internship, which I hate that term because it sounds easy. It's like, oh yeah, I have my internship, but it's hard. That's kind of where you do all the rotations. So you're learning in the hospital, you're learning in outpatient settings, that sort of thing. And then they have to pass a national exam. So it's not anyone can be call themselves a registered dietitian. So they have a lot of education behind them, and they're also going to start requiring a master's in like 2 years, I believe, in 2024. Nutritionists, honestly, anyone can call themselves a nutritionist. Um, so there's no legitimacy, I would say, to that title, just again because anybody can call themselves a nutritionist. Um, and so they don't have kind of that education behind them. I mean, I'm not saying that they're not knowledgeable. I think a lot of nutritionists are really knowledgeable and have a lot of information in terms of kind of general nutrition. But with registered dietitians, we also learn kind of more of kind of like medical nutrition therapy. So like, managing diabetes and that sort of thing. But anyways, yeah, anyone can call themselves a nutritionist. Some can be helpful, but you kind of take it with a grain of salt.
Okay, definitely. All right. Thank you for clarifying that.
Yeah, I'm glad you
Awesome.
asked that. Good question. Important for people to know.
Good, good. I know I'd heard the difference before and I was like, okay, I'll let you actually explain it because I've only heard briefly. So that was a really good description of it as well.
Yeah, and I will say with nutritionists, I have seen like kind of like abbreviations behind someone's name that calls themselves a nutritionist. So I know there are like certificates that people can get, but again, there's not a whole lot of like legitimacy behind that.
Okay, definitely. All right, awesome. Well, that was everything that I had. I'm definitely going to include some more of the resources that you provided to us in the write up in case anyone wants to look it up. And then you said if anyone wanted to contact you, that they could just reach out to me and we can make that happen.
Yeah, yeah, absolutely.
Okay, I love it. Do you have anything else that you want to share with us at this point?
Oh man, I mean, I could talk about this for hours, so you gotta cut me off.
Well, thank you so much for joining us. That was super informative, and I think it was a ton of fun to have you on here.
Yeah, thanks for having me. This is
Okay.
fun.
Okay. All right. I'll talk to you soon.
Okay.